Leading gynecology and obstetrics Dr. Professor Glenn Moller revealed on social media recently about his frustration over the difficulties faced by the doctors at the hospital daily. It is becoming more and more difficult for us to do our jobs as doctors and more challenging because of shortages of essential medicines, disposables, and equipment, Professor Moller said. He said the hospital had run out of the standard IV fluid for resuscitation of patients, while they have plenty of IV fluid which is appropriate for their use. But Moresby General Hospital had run out of Sidex needed to sterilize equipment in the labor ward and operating theater. Hence, they had resorted to just washing and drying their equipment instead. They couldn't do important blood tests because they lacked the necessary laboratory reagents, and in terms of medicines, they don't have important life-saving drugs on a regular basis. But Moresby General Hospital CEO Dr. Paki Molumi reiterated caution to his staff and affirmed that there is an ongoing chronic shortage of drugs and consumables at the Badili Area Medical Store that is affecting the hospital. The area medical store only supplies 1/3 of catalog drugs and consumables required, while Port Moresby General Hospital purchases 70% of the shortfall. National Health Secretary Dr. Liko in a media statement said the onus is on the receiving hospitals and agencies to submit the purchase order for medical supplies early so that they don't run out, but they failed to do so. That includes Port Moresby General Hospital. He said it is due to poor management. He added that the COVID-19 pandemic had also affected the supply chain globally for most goods and services, including medicines. Frida Kana, TV1 News.